Hello and welcome to Chairside, conversations about careers in dentistry. This podcast series from the British Dental Association and sponsored by BDJ Jobs explores the unlimited, unexpected, and maybe even unknown opportunities that qualifying as a dentist opens up to you. I'm Andrea Ogden, a general dental practitioner and the BDA's undergraduate and career development lead. In each episode, I'll be joined by dental professionals who discuss their journey and the paths they took that changed the course of their career. Today, we're talking about kids, community, and secure environments. The reason being is because all three of these areas so often inspire curiosity and questions when I meet with undergraduates and young dentists. And I think that's because when we're still students, we just don't get that much exposure to what it's like treating children, working in the community dental services, or becoming a prison dentist. But the breadth of skills you gain, the variety of patients you treat, and the avenues of opportunity that these areas of dentistry open up to you make them all really interesting branches of our profession, and certainly some which deserve clearer insight. So that's what we're going to do today. Both of my guests have lots of experience in these fields and some unforgettable stories to share. Welcome to Jinesh Thakrar and David Drysdale. Jinesh graduated from Birmingham in 2015, and after dental foundation training and a dental core training post in MaxFax, he spent the last 4 years working various roles within the community dental service. Welcome, Jinesh.
Thank you very much, Andrea, for the lovely introduction and for having us, and we're looking forward to the podcast.
It's great to have you with us. David qualified from Guy's, King's and St Thomas's in 2008, and he's had a very varied career, including jobs in MaxFax, general practice, paediatrics, community, and is now a paediatric specialty registrar at Great Ormond Street Hospital and the Eastman. Hello, David.
Hi, Andrea. Thank you for having me.
Thank you both for joining us. You're both so interesting because from very different perspectives, I would say that your careers have been shaped by some of the experiences that you've had within the community dental service, and I'm really looking forward to hearing more about it. So let's start with you, Jinesh. You joined the community dental service when you graduated, and you've now been there for going on 4 years. In my introduction, I mentioned that it's often difficult for students to understand what community dentistry is all about, but perhaps that wasn't the case for you. Did you have a full awareness of what it entailed? And with that, did you always intend to work within the CDS?
So for me, actually, as an undergraduate, it wasn't something I'd actually considered, and it wasn't a career pathway that I thought about. My first actual VT job was within the community dental services, but that was because not because I necessarily wanted to go and work within the community dental services at that time, but I really got on with the trainers, and it was set up to mimic a general dental practice. But within that time, I had an opportunity to see some of the community work. So I had an opportunity to explore that avenue slightly. I then did a year of MaxFax, and then I was at a crossroads within my career. I had another offer as a DCT2 post for a MaxFax role again, which I wasn't too keen on doing. There was then the option of going into practice, and community was also thrown into the mix because of my exposure to it previously. And my initial reasons of then transferring into community was to stay within a hospital trust and to help with the application potential progression into specialist training. But once I was there, I found I really enjoyed the community dental services and got a chance to be involved in so many different clinical areas of dentistry, and hugely rewarding. So in some ways, I fell into it, but I'm really glad that I did.
What do you think that it was about your experience with the community, or your experience that you have now, that you've enjoyed so much?
So for me, it was helping vulnerable people access dental care they normally have found really difficult to have. So you come home really feeling like you've made a difference to somebody's life, and you get a lot of personal and professional satisfaction from the job. Often the community dental services is the last option for patients who have had difficulty accessing care, and being there to listen and provide care for them is a great feeling. There really is a huge emphasis on a team approach, and there's lots of learning opportunities. I've had chances to work with pediatric specialists in special care dentistry, oral surgeons, and through this we've provided shared care, and I've learned a lot through case discussions. And early on in my career, I found this hugely beneficial. Secondly, you get a really varied week. For me, that's hugely important. It's something I looked for in my career. An opportunity to be involved in sedation, general anesthetic lists, domiciliary dental care, and also working within the prison as well. After that, I from a dental officer, I progressed to a senior dental officer, and there I got more involved in service development projects, creating links with other services, and having opportunity to manage and lead a team. So being in charge of clinics and teaching more junior colleagues. So it was a really eye-opening experience for me, exposed me to a side of dentistry I'd never really considered or experienced before, but one I found hugely rewarding and gained a lot from.
Yeah, that's a tremendous amount of variety. And particularly working in a prison, now that must have been quite a unique experience. What type of prison was it and what was that like?
So it was a Category C male prison. And as you can imagine, having not experienced a prison before myself, it was slightly anxious, slightly worried. And there was so many different non-dental considerations also going through my head in terms of the instrument safety. Are they all locked away? What are the inmates going to be like? What is the security and the other staff going to be? What are they going to be like? And how would you manage medical emergencies? But sort of meeting the people within that environment, all those sorts of fears were soon washed away really quickly. And it was actually a part of my week, which I really, really enjoyed. A big reason for me for working within the prison services was it enabled me to keep my clinical skills up. It was set up just like a general dental practice with no UDA target per se. And I really didn't want to de-skill, especially so early on in my career, which could be a potential risk working within the community dental services. So the prison dentistry really helped me keep up my speed, helping with my diagnosing, treating a variety of cases. And as you can imagine, there's a high dental need there, often patients with poor mental health. So really got involved in doing lots of endos, extirpations, extractions, and restorative work as well. So it's something I'd really, really enjoyed.
So if you're doing all the kind of things that you would do in a normal general practice, how does that work? Is that still within the NHS? Is it like working in a practice with a normal UDA contract?
Yeah, so it's essentially like working in the NHS. Everything was mimicked and set up to be exactly the same, and all the care we provided was in line with what you would expect for any other general dental practice providing NHS care to provide to these patients. We were, of course, monitored on our activity, but it wasn't a heavy influence on it. So we didn't have that extra pressure on top of us of needing to accumulate a certain number of UDAs, which was quite nice, especially early on in my career.
Yeah, sure. I mean, to be able to be working in that environment and not have the pressure of UDAs sounds ideal to me. I mean, you mentioned that you felt quite anxious and worried about it at the start, but were those concerns, were they warranted, or how did you find the experience in relation to that?
And no, not at all. I mean, I think after the first day, everything was very different to sort of what you'd imagined it to be. The staff there were super friendly, really helpful, very inviting. The inmates often really grateful for our help. I found the prisoners often have a standoff relationship with the prison officers, and to them, we're actually different. We're there to help them. We're not there necessarily as part of their punishment, maybe you say. And so it was really, really, they were really grateful for us, and it was all those sorts of concerns gone out the window. I never really felt threatened or had any aggressive patients.
And do you think having like the varied background that you did, the fact that you'd had the MaxFax experience, the fact that you'd been previously working within the community dental service, I mean, do you think that helped you prepare for that environment at all?
I'd say definitely both helped me prepare, but I wouldn't say it was absolutely essential to going into that environment. There are a number of GDPs that do work part-time in a prison, and I think a lot of what you do and how you manage those types of patients is you pick it up and you develop whilst you're within that environment. I do feel that the MaxFax year did give me that extra confidence in managing sort of more complex conditions. If I ever saw a fractured mandible, I was confident in knowing when to send it to hospital, what could be managed within the services there. It increased my confidence with extractions, having worked within MaxFax department for a year, and also managing medically compromised patients as well.
Sure. David, your pathway into community happened 2 years after your experience as a Max Fax SHO. What was it that attracted you to the role?
At the time, if I rewind to being at dental school, I think we had like a community day where we shadowed a community officer, dental officer, around sort of Lambeth or Southwark, wherever it was. And I remember just quite enjoying it. I thought it was actually quite nice and quite varied. And so after I did Max Fax, I'd worked in practice part-time. And so when I went to the corporate side, I didn't really have a good time there. And I wanted to do nice dentistry. And I wanted to do varied dentistry. And I remembered potentially the community was somewhere where I could do that. And so there was a job in Dorset and I applied for that job. And it was actually randomly, it was a locum band B, it wasn't a band A job. And I went there and I really enjoyed it.
Yeah, fantastic. I mean, what was it for someone who kind of has obviously really enjoyed community dentistry? How was it that you ended up leaving community dentistry to then apply as a specialty registrar in paediatrics?
So I loved community, especially my first job in Dorset, in the special care dentistry unit there, and I loved it. I loved especially treating the children, and being a band B, I realized, and I had a postgraduate qualification. I realized that I couldn't progress to band C without being a specialist, and so that was a decision what I had to make to leave the community to, again, progress my knowledge and progress my career by leaving. But that's the only reason I did leave, because again, you get to your sort of early 30s and you realize there is nowhere else to go. And so, and because I love the job, I said, I'll give it a go. And that's why I left. But if it wasn't for that, I would have stayed.
So did you leave community to go straight into paediatric specialty training, or did you have to take any other jobs?
Yeah, so I treated loads of children in the community. I treated them under locals, sedation and general aesthetic. And so when I looked into applying for paediatric training, I was told that I wouldn't pass long listing because the job didn't actually qualify or count as a paediatric job. So I went and spoke to a paediatric consultant to get some advice of how to actually progress things. And she said I had to actually go and apply for a paediatric post to work in the paediatric unit, and then I could actually apply for paediatric dentistry.
You mentioned just now that you were told you would pass long listing, and we hear a lot about ranking, but long listing doesn't seem to come up as much. What's the difference?
So with long listing, if I hopefully I get this right, with long listing, it's a certain criteria you have to basically have. It's a bit like having things on your CV before you can actually apply. So long listing is working for a period of time in a paediatric unit, having your MFDF exam or MJDF exam, having a publication, having a poster, doing an audit. Those things count towards long listing. So once you actually then have your interview, depending on how well you do in your interview, you're then given a ranking score, and that ranking score will then decide where you end up. Because the issue with paediatric dentistry, and I think the issue of many national recruitment jobs, they're national. So you may have one job in London, 3 jobs in Birmingham, 1 job in Scotland, and depending on where you rank, depending on where they actually put you.
Looking at your CV, I mean, it seems it's been a really long process certainly between graduating and you going on this specialty training pathway, and the fact that you have a master's in paediatrics, you've got qualifications in sedation and special care. Did you think that you would end up on an academic pathway if you look back to that time when you were a student?
No. So as a student, I struggled. I think I did a few exams more than once. I worked full time, and I was also working financially as well as a carer. Looking back, well, that's how I pay for dental school. It doesn't matter. But when I was in the community, it was still a good time to actually you could still do academic things. So you could still write. So I did my first paper on sedation while I was in the community, even though I had to retract it because it was really bad. But it was good practice. I did my sedation qualification while I was in the community. The problem I had with the community is you don't receive much formal training. So I was basically left to deal with all of these children with their complex needs and their traumas, etc., without any formal training. And that's why I actually decided to do the Masters in Paediatric Dentistry to help me with that. It wasn't necessarily to specialize, it was actually to help me do my day-to-day job. And it gave me a lot of insight. And when I was doing the Masters, it gave me access to a paediatric consultant as well. And we used to discuss cases, and it was really, really good. And I think it was on the back of doing the Masters and doing quite well and wanting to go further and seeing all these children, I decided to then pursue things and specialize.
So would you say that having that kind of career progression has been something that has obviously been important to you? And is that something that the community dental service provides compared to something like general practice?
Oh, that's a bit controversial. Yes, I think wherever you work, I think if you've got a supportive boss, they'll support you to do whatever you want to do, regardless if it's the community, hospital, or general practice. And I've had very supportive bosses. Even when I was in practice going towards community, my boss was very supportive of me to try the community. Yeah, so there is a little bit of funding you can get in the community. It wasn't much. I think it was, at the time I was there, I think it was only about, I don't know, £700 a year, but my master's cost £6,000 a year. So it was self-funded, and I had to find the money to pay for it myself. But I think it's important that you try and do things to keep yourself interested in what you're doing. And that's why I did all those things.
Yeah, absolutely. Yeah, that's so important. And what about after you've completed your specialty training? Is there the option to return to community as a specialist?
100%. Would I go back to Southampton, Dorset? I would in a heartbeat. My life has changed somewhat though, having children and a wife and other commitments. But I could easily go back and work as a specialist in community from what I'm doing.
Fantastic. Jinesh, as someone who's still relatively early on in their career, what's been the benefit to you in choosing to be a community dentist?
So for me, we have long careers, or the way I see it, where the retirement age is going higher and higher. So we're going to be working for a long time, and it's not always easy to figure out what aspect of care you really enjoy. During dental school, you get a little bit of experience in all different areas, but never really delve into anything. And for me, the benefit was working in a non-pressured environment and somewhere where there was a lot of variety. As David said, with local sedation, general anesthetic, really kept the job interesting. And it gave me an opportunity to develop my skills through a really supportive environment, improving my team working skills, my management, leadership skills, and my communication. And it enabled me to explore options rather than really jump into something and then regret it potentially. And also being salaried helped me with my mortgage as well. I didn't have to show a few years of accounts, and so it helped me get the house which I'm currently talking to you from now, which was really helpful as well. So yeah, there are lots of different benefits of working in a community dental services, and those were the main ones for me.
One thing that I'm curious about, and Jinesh, you alluded to it earlier, and so I'm interested to hear both of your thoughts on this, is that when it comes to community dentistry, there's sometimes this idea that your clinical skills can become more focused. So you don't tend to see the same variety that you do in general practice. What do you think about that?
It's interesting you said about clinical skills in the community. Before I actually joined the community, a couple of my colleagues quipped that I'd actually de-skill because of the people I'd see in the work I would do. And if I'm honest with you, I think it actually improved my skills. So I was quite lucky with the post I worked at. We had a private lab. We had rotary endodontics. We had a surgical drill to do surgical extractions. So, and these are things which I didn't have in general practice. So depending on where you go, you can actually have a really good time and actually do some really good dentistry.
Yeah, I mean, for me, it's you always see your colleagues doing all this aesthetic work on Instagram, and you're constantly bombarded with it. And you sometimes think, is the grass always greener? And I never really wanted to shut the door on any avenue. I'm the sort of person that wants to explore different options and really find what I enjoy first. And that's the reason I've been involved in so many different things like the prison services to keep up my skills. And as David has mentioned, that it's sort of what you put in, and there's lots of community dental services out there which can provide you with opportunities to use rotary endos and use the surgical drill for extraction. So keeping up my clinical skills is important, and practice is something I definitely would consider moving into, potentially part-time. But I've also developed my interest in paediatric and managing paediatric patients like David has as well. So I found it's really just helped me become, I feel, an all-rounded practitioner and feel more confident at managing a lot of cases. And I would feel confident if I was to make that transition into practice that I would be able to settle in reasonably comfortably as well.
Yeah, I completely agree with that. And often there is that misconception about shutting doors, but it's really just an old cliche, isn't it? That where one door closes, another or others open. And really in community, there is so much opportunity to gain so many skills. And in your case, David, I mean, you aim to build on some of those skills by moving into paediatrics, which is renowned to be a very competitive training pathway. How competitive was it for you when you applied?
Very. The year that I applied, it was 60 people applying for 5 jobs. And I think there were 2 jobs in London, and I think 3 in the Midlands and 1 up north somewhere. And when I was applying, I was told to apply everywhere, because if you didn't apply everywhere, it shows a lack of commitment to specialty. And I said, well, I've got a wife and 2 kids now. I can't go to Liverpool. It's the honest truth. And so I only put the 2 London jobs down. So when I went through the process, and the process was very, very difficult, I had to go to Leicester and stay in a hotel overnight because it's national recruitment. It's a bit like The Apprentice. They walk you through in your suit and you do your interview. And it took a lot out of me. I remember it was my son's 3rd birthday, which I'd missed because of doing this thing. But hey ho, it is what it is. And I remember, so once I got my ranking and I passed, I benchmarked to get a job, but I hadn't benchmarked high enough to get a London job. And because I didn't want a job outside of London, I was put on a waiting list. And luckily, I managed to get a job because a job was converted from a registrar job for a consultancy to. So there's 2 different levels of registrar. There's ST1 and ST4. And so because I didn't fill the ST4 position, they turned into an ST1 and offered it to me. So that's how I got my job in the end. But it was very competitive.
Yeah, that's interesting. So we've talked about the ability to diversify your skills in community, but what happens when you specialise? How does that affect the variety of work that you do?
Paediatrics is I think a misunderstood specialty. I don't think people really know what we do, and they think we just apply fluoride and use GIC. The jobs are fantastic. I do surgical marsupialization of cysts on 10-year-olds. I do beautiful composite fillings. I do anterior work. I do anterior endo. I do open apex, closed apex. I do work under microscopes. I do sedation. I do GA. I do IV sedation. Peds is a very varied specialty, and you will find something for you regarding, if you're a cosmetic dentist, you can do cosmetics. If you love endodontics, if you're restorative, if you love sedation, there is something for everyone within pediatrics. It's a very varied job, and it's actually increased the level of dentistry I do. And it's quite interesting because certain things as a GDP and as a community dentist, I took for granted. Again, I take for granted maybe doing like an anterior composite. And it's only now I know how to do a beautiful anterior composite, because we have to make them look beautiful for the children. And you learn that from the input they put into you as a registrar. So PEDS has got something for everybody.
I completely agree with David. I think as an undergraduate, PEDS is something you don't really get an opportunity to experience. properly. You're often seeing patients just for one more visit, and you don't really get an opportunity to build a rapport with them and an opportunity to see them through a treatment and see them grow in confidence and accept treatment. And having worked within the community dental services and had lots of experience in managing pediatric patients, I find it one of the most enjoyable parts of my day. It's great fun seeing a kid sort of grow in confidence, come back to see you, happy to see you, and accept treatment, which you would never have thought when they walked in the door. So I definitely think it is an avenue that people should consider, and there's a lot more to what you see as an undergraduate.
It was Durafat and GIC, wasn't it?
It literally was, and it was screaming kids and like, I always dreaded having a kid in the chair. And when I started community dental services, that was the one thing I was like, no, I can't do. And then you just get more and more experience, and it's fun. It's a good laugh actually, and you can always have a laugh and a joke with them, for sure.
Yeah, it's really something you need to properly experience to understand. And the other thing that you don't really learn about, given that we're talking about variety, is this mix of places that you can work. And David, you work in two different sites, Great Ormond Street and the Eastman. How do those sites vary?
So at the Eastman is about the dentistry, and the Eastman is about producing beautiful dentistry. It's about anomalies, it's about trauma, it's about treating well children under sedation, local anesthetic, or in the chair. At Great Ormond Street is about looking after the child. So at Great Ormond Street, we treat sick children and provide them with dentistry. So those children may have epidermolysis bullosa, so that's a skin disease where if you use a suction in their mouth, you could basically suck off their mucosa, or you could suck their lip or cause a blister. We treat cancer children where because of the cancer treatment, their neutrophils are so low, they could die from a dental infection. So those are children we treat at Great Ormond Street. So the work is very, very varied between both sites. And so both sites come together quite nicely to make me quite rounded.
I mean, you and I, we've known each other for a long time now. And I remember when you were doing your MaxFax SHO jobs, and I remember us having a conversation about whether or not you were going to take MaxFax further down that pathway. And you said that actually the amount of oncology experience that you had and dealing with those patients, those oral cancer patients whose survival rate wasn't great, you found that a very difficult part of the job. So I'm interested to know, I mean, as someone who's the father of two small children, has working with children with life-altering conditions at Great Ormond Street Hospital, has that had any emotional challenges for you? And has that differed at all from treating children in the community?
Yes. So in the community, I saw lots of children who had sort of autism, who had challenging behaviour, where at Great Ormond Street, I treat children, some of which are dying. So the case mix is very different. I try not to take my job home with me, but sometimes you do. I'm only human. The hardest time for me was when my wife was pregnant with our second child. And I'd seen some children who had difficult births and the aftermaths of those births, or were born prematurely. And so being a father of an unborn child, there was a lot of worry. Especially, I remember once, I think the day before my wife was due to have a cesarean, I saw two children who had cerebral palsy. And I was thinking, oh dear, I shouldn't really be here today, should I? But it is what it is. I still looked after those children, and I did the best I could. Is there a price to pay for working at Great Ormond Street? I think there is. But in terms of working at the best children's hospital in the world, there's nothing like it. So I try not to take it home all the time.
Yeah, it's pretty unique, isn't it? Because on one hand, it does sound very challenging, and yet on the other, it must be incredibly fascinating. I mean, you're working with people who are at the top of their game, and you get to see things that the rest of us are only ever going to read about in textbooks and papers. And I imagine it must be a real privilege to work in that environment and to be doing what you're doing. But of course, there are personal costs, and particularly if you have a family. And I really appreciate how honest you've been about that. And I know that training can be an intense time with a heavy workload, and obviously that will naturally impinge on family time.
I came into specialising a little bit later. And I think if you're married with kids, you need to consider, is it for you? It's for me, and I love what I do, and I've never not looked forward to going to work. I've worked hard to get here, and I wouldn't have it. If I could do it again, I would do exactly the same.
Yeah, I can see that for sure. So on that note, I mean, what would you say to anyone listening who has been inspired to consider a pathway into paediatrics?
Have an open mind to it. If you like children and you want to produce beautiful work, and you like oral surgery, and you like restorative, and you like management under a different way, like sedation and general anesthetic, seriously consider doing peds.
Jinesh, if you could summarize the most important things about community that you wish more student dentists or new graduates understood, what do you think they would be?
I would say it's not an avenue of dentistry I would disregard, because there are so many non-clinical areas you can learn and develop as an individual. As we've touched on before, it doesn't mean that you need to de-skill. There are so many opportunities within the community dental services that allow you to train in different areas, such as IV sedation or doing more advanced restorative work. And often it's with anything really, and any aspect of dentistry, it's what you put into there and opportunities you seek out as well. But it is an area of dentistry where if you are passionate and you want to pursue different avenues, you can do, and you will have people there to help guide you. And finally, I really found it's just a great team atmosphere with a huge level of job satisfaction. There really is a big emphasis of working collectively for the patient and providing holistic care for them. And so, yeah, those are probably the main things I'd summarize for undergraduates.
I think that's great. I mean, it's been so fascinating to hear about the variety of work that you've both been involved with. And I'm pretty sure as a student, I certainly had no idea about the opportunities available to you, certainly through the community and the incredible work that you get to be a part of within paediatrics. In fact, I think you two have made me think that perhaps I should have explored a different path. One of the most important points for me from our conversation is this idea that committing to a specific pathway or specialty is sometimes it's viewed as that you're closing certain doors, but the reality is that it opens up an array of completely new ones, some of which we're often completely unaware of. And that brings me to the end of this episode. Thank you so much to my guests, Jinesh Thakrar and David Drysdale, for sharing your journeys with us.
Thank you very much, Andrea, for having us. I'd really enjoyed this podcast, and I learned a lot from David, and it's amazing to hear his experiences too. And I hope this is beneficial for undergraduates and new graduates as well. Thank you very much, and bye-bye.
Thank you, Andrea, for having me. It's been amazing. Again, specialising has been the best thing I've done so far throughout my career. But at each stage of my career, I've always enjoyed what I've done. And it's all about investing in yourself and enjoying what you do.
Thank you. This is Chairside, Conversations on Careers in Dentistry, a podcast for the British Dental Association. If you like this episode, please check out the others in this series. And to find your perfect job in dentistry, head over to bdjjobs.com.